Hi folks, welcome back. If you're new around here, my name is Kweku. I am a pharmacist. Today I'm briefly going to be reviewing the medication Brilinta, or as it goes by its chemical name Ticagrelor, where we'll be taking a look at its description and uses. We will take a look at some side effects and some precautions or some general best practices that you should be aware of if you are prescribed Brilinta. And as always, all my reviews are for informational purposes only, and they are not intended to be a substitute for medical advice from your physician. So at a very basic level, Brilinta is a medication that is used to help prevent blood clots. It does so by preventing the platelets from aggregating or clumping together. It is therefore sometimes known as a platelet aggregation inhibitor. Brilinta is used to reduce or decrease the risk of death, heart attack, and stroke in people with a blockade of blood flow to the heart, a condition called acute coronary syndrome, or in people that have a condition where the blood flow is not completely blocked but it is reduced, what you find in somebody with, say, coronary artery disease. Another use for Brilinta is to reduce the risk of having a second heart attack if you've already had one in the past. So if you've already had a heart attack in the past, sometimes you'll be prescribed Brilinta just to reduce your chances of having a second one. Brilinta may also be prescribed to decrease the risk of blood clots in the stents of people that have received stents for the treatment of acute coronary syndrome or ACS. When it comes to side effects, one of the main concerns is hemorrhage or bleeding, which has been reported in about 2.4 to 7.7% of the people that take Brilinta. Now, this bleeding may range anywhere between minor or sometimes it can be fatal. For this reason, Brilinta is not to be used in patients with active bleeding or a history of bleeding in the brain, and also highly recommended to report any bleeding to your doctor, no matter how minor you think it is. An increase in creatinine levels, which is a general sign of kidney problems, has also been associated with Brilinta use in about 4 to 7.4% of the people who take it. In most cases, though, this increase was transient and often decreased with continued treatment. That is, as people kept taking the Brilinta, they noticed that these levels actually dropped. And for the most part, there was a reversal of this increased creatinine level when Brilinta was discontinued, even in those patients who had very high levels of creatinine concentration increases. This is just an indication that it is not causing permanent damage to the kidneys. But of course, your doctor will definitely be monitoring you to make the best clinical decision for your particular individual circumstance. Another reported side effect is dyspnea, which is difficulty in breathing. So when this happens, usually they will try to rule any underlying causes that may be causing this dyspnea and treat it accordingly. There is really no treatment for dyspnea that is caused by Brilinta. And therefore, if it is something that is not too bad, that is something that you can handle, typically your doctor will continue therapy on Brilinta. This is just because discontinuation or interrupting of Brilinta may generally lead to an increase in the risk of developing a heart attack or even developing some clots in the stent. Of course, if the difficulty in breathing becomes intolerable, Brilinta discontinuation may be warranted, and in such cases, another antiplatelet agent may be considered. There was actually one particular trial in which dyspnea was reported in about 13.8% of people taking Brilinta to 7.8% of people taking clopidogrel or Plavix. So that is an option that sometimes some doctors will switch to just to take care of the difficulty in breathing that people experience when they take Brilinta. Other less commonly reported side effects include breast enlargement in both males and females, I must say, diarrhea, dizziness, headache, tiredness, and upset stomach have all been reported among people taking Brilinta. Now, some precautions and general best practices. For starters, some people, depending on their condition, may be prescribed aspirin to go along with the Brilinta. In such cases, the general best practice is to keep the aspirin at a maximum of 100 milligrams. And therefore, it is very essential that you monitor some of the over-the-counter products that you may be taking. A lot of these over-the-counter products may contain aspirin. It may easily push you over the 100 milligram limit. This increases your risks for bleeding. So pay attention to some of the over-the-counter medications that you take, and as much as possible, limit your aspirin dosage to 100 milligrams max. Brilinta should also not be discontinued abruptly, or there should be no sudden discontinuation of Brilinta just because it increases the risk of developing all kinds of heart problems, heart attack, and developing blood clots. So no matter how serious you think your side effects are, I would highly recommend that you discuss with your doctor for an alternate therapy before you decide to discontinue Brilinta altogether. As mentioned earlier, report any unexplained bleeding or difficulty breathing to your doctor for him to guide you on the next appropriate steps, especially with the bleeding, no matter how minor you think it is. It is worth reporting such that if there is any serious issues going on, it can be taken care of immediately. Brilinta is also not recommended in breastfeeding or nursing moms, so if you plan on breastfeeding, do well to let your doctor know so an alternative may be found for you. So high level overview of Brilinta. I hope you found it useful. If you did, consider hitting that like button for me and also consider subscribing if you have not already done so. I will catch you on the next video. Thank you.